They say love finds you when you least expect it. But in a dental chair, with Novocaine numbing your face and someone's hands in your mouth, that's exactly where Maya Chen discovered something she never saw coming. This is the story of an anxious patient, a compassionate dental hygienist, and how vulnerability in the most unlikely place sparked a connection that would change everything. I'm your host, and this is An Unexpected Bond in the Dental Chair. Maya had always hated dentists. Not the people themselves, but everything about dental offices, the antiseptic smell, the mechanical whirring, the vulnerability of lying back with your mouth wide open while someone poked around with sharp instruments. At 28, she'd managed to avoid regular checkups for 3 years until a throbbing molar forced her hand. Maya Chen, called a gentle voice from the doorway. Maya looked up from her white-knuckled grip on the waiting room chair to see a woman in scrubs with kind brown eyes and an easy smile. I'm Sarah, your hygienist today. Something about Sarah's presence immediately put Maya at ease, not completely, but enough to follow her down the hallway without bolting for the exit. Sarah was probably in her early 30s, with shoulder-length auburn hair pulled back in, a practical ponytail, and a warmth that seemed to radiate from her very being. I can see you're nervous, Sarah said as she adjusted the dental chair. That's completely normal. About 60% of my patients have some level of dental anxiety. Can you tell me what specifically worries you most? Maya appreciated that Sarah didn't dismiss her fears or offer empty reassurances. I guess it's the loss of control, Maya admitted, surprised by her own honesty. Being trapped in this chair while someone does things to my mouth that I can't see or stop. Sarah nodded thoughtfully. That makes perfect sense. How about we establish some signals? Raise your left hand if you need a break, and I'll stop immediately. No questions asked. You're in control here, Maya. As Sarah began the examination, she kept up a steady stream of gentle conversation, nothing intrusive, just observations about the weather, a funny story about her cat, questions about Maya's work as a graphic designer. Her touch was incredibly gentle, and she narrated each step of the process. I'm just going to take some x-rays now. You'll hear a little beep, and then we're done with that part. What struck Maya most was how Sarah never made her feel foolish. For her anxiety, when Maya's breathing became shallow during the x-rays, Sarah immediately noticed and guided her through a simple breathing technique. In through your nose for 4 counts, hold for 4, out through your mouth for 6. That's it. You're doing great. By the time the cleaning began, Maya found herself actually relaxing. Sarah's hands were steady and sure, her movements economical but never rushed. She took breaks without being asked, checked in constantly, and somehow managed to make even the uncomfortable parts bearable. You know, Sarah said during one of these breaks, you have really interesting artwork on your phone case. Did you design that yourself? Maya smiled, the first genuine smile she'd managed since walking into the office. Actually, yes. It's based on a series I did about finding beauty in unexpected places. Sarah's eyes lit up with genuine interest. That's incredible. I'd love to hear more about your work. Art has always fascinated me, but I have zero talent for it myself. Then just like that, Maya realized her heart was beating fast for an entirely different reason than dental anxiety. So, what made you choose dental hygiene? Maya asked during her next break, genuinely curious about the woman who had somehow transformed her most dreaded appointment into something almost positive. Sarah's face brightened. Honestly, I love the combination of healthcare and getting to know people. Everyone has a story, and there's something about this environment, maybe because people are vulnerable, that makes them open up in ways they might not otherwise, like therapy, but with better lighting and more fluoride. Maya quipped, surprising herself with the joke. Sarah laughed, a rich, genuine sound that made Maya's chest flutter. Exactly. Though I promise I'm not analyzing your childhood based on your flossing habits. Good, because that would be a very short and disappointing analysis, Maya admitted. Hey, you showed up. That's the hardest part, Sarah said, resuming her gentle work. I see patients who've avoided dental care for decades because of fear or bad experiences. You're here, you're communicating your needs, and you're taking care of yourself. That's actually pretty impressive. Maya felt warmth spread through her, just that had nothing to do with embarrassment. When was the last time someone had praised her for something so simple? When had anyone looked at her anxiety and seen strength instead of weakness? Can I ask you something? Maya said during the polishing phase, of course. Do you ever get nervous? In your personal life, I mean, you seem so calm and in control. Sarah paused her work for a moment, considering the question. All the time. I think everyone does. I'm actually terrible at dating, if I'm being honest. I get all tongue-tied and awkward when I like someone. Really? I find that hard to believe. It's true, Sarah said, a slight blush coloring her cheeks. Put me in a professional situation and I'm confident. But ask me to have a normal conversation with someone I'm attracted to. Forget it. I turn into a complete mess. Maya's heart skipped. Someone Sarah was attracted to. She found herself wondering who that might be, and then caught herself wondering why she cared so much. I'm the same way, Maya said. Well, except I'm also a mess in professional situations. In social situations, really, I'm just generally a mess. You don't seem like a mess to me, Sarah said quietly. You seem thoughtful and creative and brave enough to take care of yourself, even when it's scary. Their eyes met, and Maya felt something electric pass between them. Sarah's gaze was soft but intense, and Maya realized she was holding her breath for reasons that had nothing to do with dental procedures. All done with the cleaning, Sarah announced, though she seemed reluctant to break the moment. Dr. Martinez will be in shortly to check everything over, but from what I can see, you're in pretty good shape. The tooth that was bothering you just needs a small filling. So I'll need to come back? Maya asked, and she could hear the hope in her own voice. Absolutely. We'll get you scheduled for next week. Sarah's smile was warm and maybe, just maybe, held a hint of something more than professional courtesy. The week between appointments crawled by. Maya found herself thinking about Sarah at the most random times while designing a logo for a client. She'd remember Sarah's laugh. During her morning coffee, she'd wonder what Sarah did on her days off. She'd even caught herself researching dental hygiene programs online, which was definitely not normal behavior. You're glowing, her best friend Jess observed over lunch 3 days after the appointment. Did something happen? New project? New girlfriend? New dental hygienist, Maya said, then immediately felt foolish. You're excited about dental care. Now, Maya, who are you and what have you done with my dentist-phobic friend? Maya found herself telling Jess everything. Sarah's kindness, their easy conversation, the way she'd felt seen and understood. As she talked, she realized how much the encounter had affected her. Honey, Jess said gently, I think you have a crush. On my dental hygienist, Maya groaned. How pathetic is that? It's not pathetic. It's sweet. And maybe she likes you too. Right, I'm sure she connects deeply with all her anxious lesbian patients. Wait, how do you know she's gay? Maya paused. I don't, actually. I just assumed. The way she talked about dating, she said, someone I'm attracted to, not men, specifically ... Exactly, trust your instincts. When Maya returned for her filling appointment, she was nervous in an entirely different way. Sarah greeted her with the same warm smile, but Maya thought she detected something extra, a brightness in her eyes, a slight flush to her cheeks. How's the tooth been? Sarah asked as they got settled. Fine, actually. Much better. You were right about it just being a small issue. I'm glad. Though I have to admit, I was hoping you'd say it was bothering you. Maya's heart stopped. Oh? I mean, so we could address any ongoing concerns, Sarah added quickly. But her blush deepened. Dr. Martinez performed the filling efficiently while Sarah assisted. Throughout the procedure, Maya was hyper-aware of every time Sarah's hand brushed hers, every concerned look she gave when checking on Maya's comfort level. All set, Dr. Martinez announced. Sarah will go over aftercare instructions with you. When they were alone again, Sarah seemed to gather her courage. Maya, can I ask you something? Of course. This might be completely inappropriate, and please tell me if I'm out of line, but would you maybe want to get coffee sometime? Outside. Of the office, I mean, as not patient and hygienist. Maya's smile was so wide it made her newly numb cheek ache. I would love that. Though I have to warn you, I'm much more articulate when I'm not lying flat with dental equipment in my mouth. Sarah laughed, relief evident in every line of her body. Good to know. Though for what it's worth, I think you're pretty articulate anyway. Even when I'm having an anxiety attack. Especially then, you were honest about what you needed. That takes real courage. As Maya scheduled her next cleaning appointment, suddenly, regular dental care seemed very important. Sarah slipped her a piece of paper with her personal number. Text me, she whispered. I get off at 5. Maya floated out of the office, clutching the paper like a lifeline. They met at a small coffee shop downtown the following Saturday. Maya arrived 15 minutes early and spent the time alternately checking her reflection in her phone camera and trying to remember how to have a normal conversation when Sarah walked in wearing jeans and a soft blue sweater that brought out her eyes. Maya's nervousness transformed into something warmer and more exciting. Hi, Sarah said, sliding into the seat across from her. Hi yourself. You look ... really good. Different out of scrubs. Good different or bad different? Definitely good different. Though the scrubs were pretty great too. They ordered drinks and settled into conversation with surprising ease. Without the clinical setting, Maya discovered that Sarah was funny, well-read, and passionate about environmental conservation. Sarah learned that Maya's art was inspired by her travels, that she volunteered at an animal shelter, and that she made terrible puns when she was nervous. Okay, but seriously, Maya said after a particularly bad joke about coffee beans. How did you know? That I might be interested, I mean? Sarah smiled into her latte. Honestly, the way you looked at me, and the way you kept finding reasons to ask questions during your appointments. Plus, you scheduled a cleaning for 6 months from now, immediately after getting your filling done. Most anxious patients wait until the last possible minute. Guilty as charged. Though in my defense, you made dental care significantly less terrifying. Is that all I did? Maya met her eyes. No, you made me want to be braver. Their first kiss happened 3 weeks later, after their 4th coffee date and Maya's follow-up appointment to check on her filling. Sarah had walked Maya to her car, and they'd stood talking for 20 minutes about everything and nothing. I should let you go, Sarah said, but neither of them moved. Yeah, you should, Maya agreed, stepping closer instead of toward her car. Maya, yeah, I'm going to kiss you now, if that's okay. More than okay. Sarah's lips were soft and tasted like the mint tea she'd been drinking. The kiss was gentle at first, tentative, and then deeper when Maya responded by pulling her closer. When they broke apart, both were breathless. I've been wanting to do that since your 2nd appointment, Sarah admitted. Why didn't you? Professional boundaries. In terror. Well, I'm not your patient right now. No, you're not. 6 months later, Maya never missed a dental appointment. Not because she'd overcome her anxiety, though Sarah's presence helped enormously, but because it meant guaranteed time with her girlfriend. Sarah had introduced her to her colleagues as my favorite patient turned favorite person, and Maya had created a series of dental-themed artwork that Sarah proudly displayed in her operatory. You know what's funny? Maya said one evening as they cooked dinner together in Sarah's kitchen. What's that? I spent years avoiding dentists because I was afraid of vulnerability. Turns out, being vulnerable was exactly what I needed. Sarah kissed her temple. Good thing you had that toothache. Best cavity I ever had. Maya and Sarah's story reminds us that love truly can bloom in the most unexpected places, even in a dental chair. Their relationship, now 2 years strong, began with honest communication about fear and grew into something beautiful through mutual respect, kindness, and the courage to be vulnerable. If this story resonated with you, we'd love to hear about your own unexpected love stories. Share them with us on social media using hashtag #unexpectedlove or email us at hello@unexpectedbonds.com. And remember, sometimes the best connections happen when we're brave enough to be authentically ourselves. Even in the most unlikely circumstances, subscribe to our podcast for more stories about love found in unexpected places. And don't forget to rate and review us on your favorite podcast platform. Until next time, stay open to the beautiful surprises life has in store.